Welcome to My Spoonie Sisters, featuring stories from special guests dedicated to empowering those with chronic illness. Our goal? To connect people and provide the support and tools they need to live a better life. For those with chronic illness, our energy levels just fade faster. We must be more purposeful with the spoons allotted to us. So grab your coffee or tea, sister, and tune in as My Spoonie Sisters share stories of living with chronic illness. Hi, my Spoonie Sisters. I am your host, Gracefully Jen, and I am so excited because I have the honor of talking to Dr. Saimun Singla. She is a triple board certified physician. I feel like I will butcher it if I even try to describe all the amazing work that she does. I'm just going to dive right in and let you take it from here. But hi and welcome. How are you?
Thank you. Thank you so much for having me. I am doing very good. Thank you. There's a lot in there, so I don't blame you for feeling like you're going to butcher something, but it's relatively straightforward. So I am a board certified pediatric rheumatologist, and most recently I added on extra training in something called integrative medicine, which focuses a lot on like lifestyle, incorporating lifestyle things into having a chronic illness. And so I am from Houston, Texas, and I myself have rheumatoid arthritis as well. And a lot of people think that I went into pediatric rheumatology because maybe I like kids, I have arthritis, it makes sense, but it's actually not that route at all. So I would say my journey was a little bit of a backwards take. I loved children, I loved immunology, I loved the physical exam, so I went into pediatric rheumatology. And then after becoming a full-fledged rheumatologist is when I got my diagnosis of rheumatoid arthritis. So it was quite backwards because most people have an illness, get inspired to do research in it or specialize in it, and then they, become that specialist. But I was already a specialist before ever getting diagnosed with it. So it's a little bit of a unique take, I would say, on having an illness.
Absolutely. And you said that you were, well, we talked about this a little bit beforehand before we started recording, but you actually started having signs and symptoms at an earlier age.
Right. So, yes, we all know juvenile rheumatoid arthritis up until 16. Anything after 16 years of age is titled rheumatoid arthritis. And that's the reason for that is because rheumatoid arthritis acts a little bit differently than juvenile idiopathic arthritis, certain subtypes. And I started getting symptoms probably like my first year out of training, where I would get some stiffness in my hands, a lot of fatigue. And I think a lot of us just attribute that to life, like being a woman. I had my second child at that time. I was trying to balance being a real doctor with a family, a career. So I just thought, it's that. But then in the mornings when I couldn't wake up, or had trouble bending my fingers and kind of grabbing my hairbrush, that's when I realized that there's something probably a little bit more happening. And that's when I reached out to adult rheumatology colleague who kind of squeezed me into her lunch break. I was like a pseudo patient, like a drive-by, like, let's just go in, let's see, we'll give you a yes or no. And sure enough, she was like, I'm concerned based on your history, based on your exam, let's get some labs, and which led to the full-fledged diagnosis of RA. Oh, I can't hear you for some reason.
Oh, I was still muted. That sounds amazing that you had someone in your office that you could reach out to.
Yes, because most people don't have that luxury. I mean, there were two things going on. I had the luxury of having an adult colleague, and I was also in denial. So I was kind of like, we'll get to it when we get to it. Sure, cool, I'll come by, and you can take a look at me. And it turned into like what was probably going to be like, it's okay, you're fine. I'll, if something happens, call me in 6 months. It turned into a very long visit of, this is a real thing for you, and what are we going to do moving forward? And so by the time I got my diagnosis, from when I was having symptoms to my actual diagnosis, it was probably 6 months or so. 6 months of just sitting there and kind of thinking, this will go away. And finally it didn't go away. So I was a bad patient. I was a bad patient from day one. I should have talked to my PCP and said, hey, I have pains. They would have started the workup. I probably would have gotten into a rheumatologist at that 6-month mark anyways. But that's essentially when I got the diagnosis.
I think a lot of us start out as a bad patient because we don't want to admit that there's something wrong.
Right.
And so I think there's the stigma out in the world that people that talk about their chronic illness and their chronic pain, that we want attention. Yeah. And I want people to understand that that is so far from true, because a lot of times we spend even years pretending this is not happening.
Right. No, I agree. And I think because we perceive it, I think, as a sign of weakness, right? Like, especially going through medicine or any professional career, you don't make a peep when you have issues. You put your head down, you continue working, you just push through it, that grit kind of mindset that you're taught. But I think it's important to realize what's the difference between me pushing through it and persevering versus this is a red flag of something actually, that something might be wrong. Right. And to me, I didn't know that. I didn't know what the difference was. And unfortunately, I found out later that this is what it was. And we all know that the longer you go untreated, the harder it is to kind of tame the arthritis down the line. And so I didn't know all that. Now it's all hindsight, right? Like, I can put the dots together, but I didn't at the time.
So what does your care plan look like now that you're full in it?
So now it's been like 10 years of having this, and it's been a roller coaster, I would say. I think my mindset going in was that I have the diagnosis, I'm going to take these medications, and boom, like, we're in remission. But in reality, it took me 8 different medicines, biologics, to get to where I am. And to say that, like, failure is not really a comfortable feeling for me is an understatement, right? Like, for anybody, you don't feel good when you try something and then you fail. You try something, then you fail times 8. And it's been a learning curve. And I think I've had to give myself grace and patience through the process, and that it's not really anything wrong with me. It's just, unfortunately, this is the way it is. But I shouldn't give up.
Absolutely. It just happens to be this is how your body works. And there's several of us that are in positions like that. Yeah. And all we can do is go from here and do the best that we can.
Right.
Remission is possible, but it doesn't necessarily mean it's possible for everyone.
Yeah.
And that's okay too. We can still live a seemingly normal life.
That's the thing. I think the bigger picture is, I mean, you can not have arthritis and make a life that's not fulfilled either. Like, let's look at the opposite end. So yes, this is kind of annoying. No one likes to have a road bump, but at the same time, it's not limiting me in pursuing what I want to do. I'm still the pediatric rheumatologist I set out to be. In fact, this journey has changed the way I think I handle the illness and teach patients these ups and downs that will happen. But they don't represent the entire lifespan of your diagnosis.
Absolutely. So I have a question for you. And since you're on kind of both sides, yeah. I think there's questions that sometimes we don't think to ask. Once your rheumatologist comes back and says, okay, this medication's not working for you.
Right.
What does that look like? How do you decide that a medication is just not the right fit? It's time to move on.
Right. So I always give a medicine a full try, because it's very hard to ditch a medicine and go on to the next class or cousin of the medication that you're on. So I always look for, I spell it out for my patients and I say, this is what I'm looking for. We're looking for remission. What does that mean? That means when my hands touch your joints, I'm not feeling active arthritis, your range of motion is good. That might mean that we hit partial remission. Right. So it might not be to the point that I like it, but I might use the word partial remission. That's still not good enough for me. So either I add on a different medication, or at that point we say, okay, we've maximized the dose, we've maximized the frequency. This is the longest time I've allowed your body to be on this. Now it's time to move on to something else. So we kind of have to play it by ear. That's the annoying part about this.
And a lot of times, many of us are on, a collection of medications Do you want to explain what that looks like
Right.
and why we do that?
Right. So according to the American College of Rheumatology, which is like our guiding group that kind of tells us what medication to start and whatnot, depending on the type of arthritis you have, you start with one medication. Typically, that's like your methotrexate, naproxen, steroids, something like that. And then if that doesn't work, then we go up the pyramid. And by up the pyramid, I mean we start adding biologics. Now, some rheumatologists are trained differently depending on where your arthritis is and how aggressive it is. You go straight to a biologic. You go right up the pyramid. And if that one biologic doesn't work, then we add on methotrexate. Typically, you don't layer two biologics together because it can suppress your immune system way more than we'd like it to. But methotrexate plus biologic is okay. So for some of my more aggressive ones, yes, you're on 2 injections a week or 2 injections here and there. But it's just, I always say we have to be as aggressive as your immune system. It's not an even playing field, unfortunately. There's not much we can do about that, but it is what we have to do to put you into remission.
Yes, and what works for you might not work for me, and what works for me might not work for you, and,
Yeah.
and that's okay.
Right. And that's interesting that you say that, because a lot of people, I do integrative medicine, so a lot of people think that means that I'm not going to go to biologics, and try all the herbs and supplements out there and diets. And it's not a black and white thing. What I say is it's not a black and white thing. So what works for you works for you. Congratulations. But the immune system is built, our genes are built in a certain way where that might not work for me. Like maybe blue hair won't look good on me. So sorry, that's one of my 3 littles in the back.
That's okay.
But real life. And it's not so black and white. Rheumatologists in general live in the gray area. So whether it's your diagnosis, whether it's the medicine we're treating, we kind of play it based on what your response is. And so we got to find what that combo of meds is. Maybe it's 1, maybe it's 2, maybe it's lifestyle plus these medications that you just need it all.
Yeah, absolutely. Okay, so I'm trying to figure out where to go from here, because I mean, there's so much I can ask you. It's so fascinating. So, what sparked your interest to go into this field?
Well, in pediatric rheumatology, it was the pure love for kids, having that longitudinal connection with families when you're dealing with a chronic illness, seeing them from beginning, to transition to adulthood. Obviously, I can't take care of them forever. And kind of seeing that whole process, I really enjoyed. And rheumatology is just fascinating to me because it's one of the few fields where labs and imaging are there, but your hands and your ears are what gives you more and more clues, because we need to be really good at the physical exam. We need to listen to the story to kind of figure out what's worrisome, what's not. Labs and imaging are always there to support what we're thinking. So that led me, and I'm very detail oriented, like to just in general have always been. So immunology, like the joint count and all that kind of stuff, I was fascinated by. It makes for very long visits, but it's okay. I'd rather know everything about my patient than kind of guess.
Absolutely.
So that was the pediatric rheumatology kind of traditional route. And then after my own diagnosis and after failing medicine after medicine after medicine, I felt like maybe there was a little bit more to my overall wellness other than just the silo of rheumatology, right? Like I'm a person at the end of the day. I have kids. You can hear them in the background. I like to go out and eat with friends. I'm a social person, and that might mean that I stay up later than normal. But I never understood how those interplayed with my overall illness. And integrative medicine kind of allowed me to have that lens of maybe if you don't sleep 8 hours a night, for most nights, you're going to flare. Like this is not good for your overall health. And that is something that you can control, right? That's not somebody else giving me the locus of control. I decide when I go to bed. So just changing my mindset around this is kind of what works for me. This is what doesn't. It was a game changer for me. Game changer.
So it looks like you're in a pretty good place. Do you consider yourself in remission?
I would say I've finally gotten into remission. After my 3rd pregnancy, I flared again. And then I got the COVID booster, which caused me to flare again, I think like many of us. So it's been a rough road since 2020, but I think I'm finally kind of settling down again. And that's been hard for me to kind of swallow because I came from a point where, yay, I'm in remission. This is getting boring, right? Like I take my medicines, do my labs, it's all good. But then after the flares, I kind of felt very defeated almost. And I had to retrain my brain to think like, this is part of the process. We're going to get back to remission. I need to do my part in adding to that, right? So that meant getting to bed on time, eating better, leaving parties at a certain time, right? So I can get home. And that was just kind of a real talk with myself. And now I'm finally at a place where I can predict when I'm going to flare. I know exactly what I need to be doing, or even through different social media outlets or support groups. It's what are some other things we can do besides just take medicines for the aches and pains? Because that's, I think, part of the long haul.
Absolutely.
Right? So like Epsom salt baths or paraffin dips or yoga, those are all things that no one taught me other than people who had it or myself.
Calling all Spoonies. As a host of a chronic illness podcast, nothing lights up my day more than hearing from you, our incredible listeners. Whether it's a topic close to your heart that you want us to uncover, or you are keen to show your own journey as a guest on our show, your voice matters. Living with chronic illness can often feel isolating, but through the power of podcasting, we can come together as a community to uplift, educate, and inspire one another. Your stories, insights, and questions drive the conversations we have and the topics we explore. So if there's something on your mind, a story that you are just itching to share, or a guest you'd love to hear from, don't hesitate to reach out. Your voice is not only welcomed here, but celebrated. Let's continue to amplify the voices of those living with chronic illnesses and create a space where everyone feels heard, supported, and empowered. Together, we are stronger. And I think that sometimes people think if we bring up the word yoga, if we bring up anything like that, they're like, oh, you're saying that's a cure, and people are offended. Mm-hmm. But I think what we need to do is look at the bigger picture, and it's so important to get movement in that our bodies can handle. Right. It's important to get that stretching in. If we just sit around all day, we're going to hurt that much more.
Yeah. No, it's true. Being inactive isn't great. These aren't things that's probably why I pursued integrative medicine, because these aren't things that we're taught to view in like it's either this or this type of route is where we live currently. And it's mind blowing to think that you can have the best of all the worlds of therapy out there, right? Like I like the idea of acupuncture for patients that need it. There's good data for patients with osteoarthritis or just low back pain or musculoskeletal pain in general. Like if it's going to help your symptoms, why wouldn't you try it? And notice I said help, not treat everything. Right. And so I think wrapping your head around this works and being open-minded about it is what matters.
Definitely. What would you consider to be the top 5 things in your Spoonie toolkit to help you?
I think for me, it's getting rest. So that might mean especially the days of my methotrexate or day after, I time it to where it's on a weekend. So I have the grace to nap, right? Like my husband watches the kids, even if it's like 30 minutes. So I'll nap and listen to my body. That's number one. Part of that, I try to get massages when I can. Obviously, it's financially and like time-wise, it's a big commitment. But if I could do it like once a month, I try to get that in because it helps me also just from a relaxation standpoint. So that really helps me. Yoga is a big one for me, just to, like you said, to keep that range of motion going, that stretching. Also hits the mindfulness component of just kind of being still, because I'll go into yoga like, I need to do this, I need to do that. And then I come out and it's like, got this. So that'd be number 3. I think number 4 of having the mental discipline of knowing when to say yes to things and when to say no to things, especially like having my own practice now. You just want to be a yes woman and say yes, 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 yes to everything. But that's just, it's not the reality. And I did that initially, and I realized what a detriment that was to my health, because mentally and physically, trying to fit in a bunch of things, I couldn't do that. So I had to put some boundaries in place. That was number 4. Number 5, I think We did the physical stuff, the mental stuff, but I think the social support is also critical. Like being around people who don't understand why you don't want to be out till midnight, probably not, or like they judge you or they're like, oh, come on, you're too young not to be out till midnight. Like I don't need that energy. I also shouldn't feel like I need to explain myself to you.
100%. Do you feel like that's affected your relationships and friendships?
Sometimes I think people that don't understand the illness, I would say, they don't get why I can't just push through, just like we've done everything else in medical school and whatnot. It's like, well, why can't you just push through? You did residency, you had 36 hours of no sleep, and you were fine. Actually, I wasn't. I don't think any human is okay after not sleeping. Uh,
Yeah,
but
it's not normal.
it's not normal. Like we normalize these things, and they're really not. And so for me, it's a lack of understanding. I don't think they mean it personally. I think it's more of a lack of understanding on their end. And so I just move right along from that.
And I think that's a really good point. I think sometimes we let that get into our minds, and it's not worth it. We need to
No,
let it go. And if they're not going to understand, they're not going to understand.
no. And like, why fight the battle? Because it's going to keep coming up in different ways.
Absolutely. And stress isn't going to help how you're feeling either.
No, stress is I think most people don't realize, like, when stress is good to a certain point because it pushes us to do things like finish tasks and like get stuff done and be a certain way. But at the same time, when you live with it chronically and the worries, it's not healthy for our immune system. It kind of pushes you over into this inflammatory state that people with arthritis, it's the last thing they need in their life is more inflammation.
Yeah. And I think it goes back to where you said boundaries. Boundaries are such a huge part of our lives, and we have to have them. It's important.
Right. And I come from a culture where really you're not taught boundaries, or you're not taught to talk about it. Right. Like my parents came as immigrants and they did whatever they needed to succeed. And their vision of success looks very different of mine. Like I'm very content with a tea and a blanket on my couch on a Saturday night. And that's okay for me. Like I have no problem just kind of slowing life down, because I realize that where I need to put energy in is with the people that understand me and care about me. And so that's where my efforts are.
Well, and to my understanding, with your culture, isn't there a big excitement about parties too?
Yeah.
And there's probably a lot of people.
Yes. Like food. Have you ever been to an Indian wedding? It's like a week long. So it's
I
a
can only
huge
wish
thing.
I could go to one. That sounds amazing.
Not when you have arthritis. It's like I got married pre-diagnosis, but it was like a 7-day affair, and you're just like constant. It's a huge deal. It's not just a me and my husband affair. It's like a family affair, right? So everyone's hanging out and it's fun. I get it. I totally get it. But at the same time, like when I'm looking at my kids, I'm like, if they want to do that, I'm all for it. If they don't want to do that, I'm all for that too, because you determine what your values are. That's, I think, where things got lost in translation coming over from India to here.
Yeah. Yeah. Not everybody can handle a week-long party with thousands of people.
And no.
Maybe in another life, I would really love to try it out, but I would probably go to bed pretty early every night.
Oh, yeah. Yes. It took me probably 2 weeks to recover from that whole thing.
Oh, wow. Okay, so why don't you tell us a little bit about Room to Grow?
Sure. So after my diagnosis, like I said, I pursued integrative medicine fellowship, and just last year I decided to kind of be brave, and I thought, day to day I was living my life as an arthritis patient, but I was also living a very parallel life to my own patients. And I realized that we were both wanting the same thing, which is someone to not just listen to our joint problems and our fatigue problems, but also our whole life. Like how is this going to fit into our whole life? Because I wasn't going to do the other way around. I wasn't going to dance around the arthritis, right? So I decided I need to create a practice where I give that space for families. So they come to me. Yes, of course, we're treating the arthritis however we need to, right? We're doing labs, imaging, all that. But then I also do the practical stuff like, okay, what are you going to do when you have a flare? You're traveling abroad or you're traveling for a Christmas break for a week. What are you taking in your bag? Like, so the real life stuff I address. We do a lot of mindset work as well. So what are you going to do when you flare and because you're stressed? How are you handling your stress? Are we brushing it underneath the rug, or are we doing something daily? So I address like the mind body component. We also talk a little bit about the diet. In kids, I most definitely don't like to restrict or push any sort of specific diet. We just talk about kind of what the anti-inflammatory foods are and how we expose children to that kind of daily. And then also the sleep component. How do we optimize sleep habits with the era of iPhones and screen time? That's been very difficult. And then aromatherapy I incorporate as well. Kids love that right before bed. I do that with my own kids. Supplements, I don't do it to treat the overall condition. It's more the things that I think are missing from your life. And for most people, that's vitamin D, especially if you've been on steroids for a while. I'll check a level to see where you are. There's some newer data coming out about probiotics as well and the gut microbiome. So I always think about risk benefit analysis, like what's the benefit of taking it versus the risk. So as long as the benefit is higher, I'm all game for it. The third one I think about is fish oil as well, because again, it's not that it's going to fix all your inflammation right away, but for the long haul, it helps lower decrease of things like heart disease, stroke, hypertension, all those kind of things. So I definitely like to keep the regimen as simple as possible, but for certain people based on kind of their lifestyle, I do talk about the various supplements for them. And some people are open to acupuncture for pain or yoga or things like stretches. I make sure that we work with a good PT who understands arthritis as well, and what type of exercises you could be doing for that.
I think that's really important. I think a good physical therapist that understands it is crucial, because, I had surgery back in April and I saw two different ones, and I hated one of them. I absolutely hated her. And part of it was she wouldn't touch me. And part of me was like, you need to touch my shoulder. You need to feel where the problems are. And the other one, that's what I was used to her doing. But she was fully booked out after my surgery for 2 months. So I had to go see this other one. Yeah. And as soon as I could, I went back to my original.
Right.
And, I think it's important to find a good fit for you that understands what's going on with you.
Right. No, and I'm, one of the other things I've really pushed for now is I'm on the board of the Arthritis Foundation here. And I think for kids, having that sense of community, that you're not the lone wolf kind of going through this. There's other kids just like you. So we try to do kind of quarterly events to get all of them together to do something fun, like not sit around and talk about their joint pains, but they'll go cook, they'll do bowling, they'll do, something fun. So they realize that we're all normal, and the parents go talk. And so I'll mingle amongst both groups and kind of get the lowdown on, what they're talking about.
Yeah. Okay. So I wrote a couple notes down based on what you were talking about a second ago. Yeah. Okay. So as far as AIP goes, are there certain foods you would recommend to stay away from because they can cause more inflammation?
Yeah, and then these are no brainers. It's going to be your processed food and sugary foods. Those are your two biggest culprits for any disease across the board. Inflammation is going to be there. So anything frozen that you can pull out of the freezer and you cook for dinner, other than a frozen vegetable or fruit, probably a little modified. The sugar component for sure. Like they're hyper palatable foods for a reason, for us to kind of crave it and keep going back to it and creating habit loops, right? So those are the two big ones. Sometimes people will ask me about gluten, tomatoes, nightshades, and whatnot. Gluten is its own little world. So if you have celiac disease, yeah, you should absolutely be staying away from gluten. Now, I have a big chunk of patients, I would say, who, whenever they eat gluten, they don't feel great. Whether it's manifested as headaches, belly pains, joint pains, I'll say, okay, let's limit it. Or find gluten-free options. And then what I closely monitor is the weight and height for kids to make sure that even though they're restricting that they're still growing. Because I want there to be a balance between them growing and not feeling horrible with what they're eating. So that I kind of talk about. And then the other part is with the nightshades, the data really comes to us from osteoarthritis patients. So whenever you see a title that says this is treats your arthritis, be very careful. There are different types of arthritis. You need to make sure they're referring to inflammatory immune mediated rheumatoid arthritis, because osteoarthritis is a very different beast. That yes, we might all be destined for osteoarthritis at some point, but that is a different mechanism, right? It's the wear and tear. And there was some data saying that people that eat tomatoes, or the lycopene component of tomatoes, causes them to have pain. And so if your outcome is pain, I don't want it to be causative, like tomatoes equals pain. There's a big path in between. And so it's always trial and error. I won't say don't eat this. And then some people also ask me about lectins. It's like the new thing with certain types of vegetables, that they have this outer layer that can irritate the gut lining. I said, well, does that food cause you to have joint pains or belly pains, or to worsen anything, right? And if the answer is no, then we continue. And if it is, then we try to modify it. I was like, okay, let's pressure cook your beans, or, things like that, and see how it works. It's very much trial and error. There's not a black and white, yes or no, this is going to lead to this.
Yeah. Yeah. And, I think for me personally, if I eat a nightshade and shortly thereafter my stomach's upset, well, maybe that means that my stomach really just doesn't tolerate it that well.
Right. And then you've learned, and there are tons of other vegetables for you to try outside of the nightshades too, right? It just, all that matters is that you're getting in the ones that your body likes.
Yeah. Yeah. And I'm not going to lie either. I still eat some of those things that I like, because I love tomatoes on pizza. It's so good. It's so good.
Right.
But my stomach does not like tomatoes. And so I try to limit.
You have to listen to that part too, right? Just like sleep for me, if I don't get enough sleep, I don't feel too great. So I have to listen to that, because I know what the flip side holds.
Exactly. So, if you know a tomato or even milk or whatever it is going to upset your stomach, but you still want to enjoy it, really try to limit it. That's what I would say.
Right. Or is there a way that you can have it in a modified setting that you can still say you can enjoy it?
Oh, yeah. Yeah. Because, I think if they're stewed or baked or in a spaghetti sauce, it doesn't bother me. For some reason, if I just pick a tomato, wash it, and cut it up, within a couple hours, my stomach's just not happy. And it is what it is. Yeah. So I have to think outside the box.
Right. And you wouldn't have never known probably to pay such close attention until you're dealing with your own health issues.
Yeah. And I think for anyone that has stomach problems, you start to really pay attention to those foods every single time. And I mean, it's a little outside of the arthritis issue, but sometimes those of us with the arthritis problems have stomach problems too. So you want to really pay attention to every little aspect.
Exactly. Until you start talking to other people and asking questions, you won't know to look for that.
Yeah. Well, and then medications sometimes affect our stomachs too.
Yeah, absolutely. You kind of have to time things accordingly,
Absolutely.
Take this with food, take this at night. Don't take this on a Monday morning.
Yes. If I have a big day tomorrow, it's probably not a good idea to take my methotrexate tonight if I know it's going to upset me. Right.
Exactly. You learned.
Oh, wow. Okay. So aromatherapy, what would you say is your favorite?
My favorite. So everyone is so different. Some people just hate aromatherapy, by the way. It's too overly stimulating for them. Oh, but for me, I'm very basic. I like the Bath and Body Works, like eucalyptus peppermint one right before bed, especially. I think what we're trying to do is engage all our senses. So sight, sound, smell, especially right before bed, to cue in the brain to let them know, like, all right, this is the time to go to bed. We're going to let go of all our thoughts and just let our brain rest, because rest is very critical for us. And so I like the peppermint eucalyptus on my pillow. I just spray it. Some people like diffusers. That's fine too. Or candles or incense, whatever floats your boat.
Yeah. And, my husband also loves all the minty things, all of it. He even has peppermint oil that he puts in his bath water. And my daughter, she's a huge fan of lavender. And then I am a huge fan of combining peppermint and orange.
Yeah, you can do that.
It feels like just such a cheerful combination. I love it.
Yes, and actually aromatherapy also helps for nausea on methotrexate days too. So like right before I'll take the citrusy ones too, like the orange. It helps taking a deep breath, doing the injection, and then exhaling. And so whenever I do get a little bit nauseous, I'll do deep breathing with a little bit of the orange essential oil in front of me.
That's a wonderful tip.
Yeah.
I'm going to try that.
Yeah, try it. It's better than having to take Zofran every 7 days. I don't want to do that forever either. So I try to do what I can before getting to the anti-nausea medicines.
I do a lot of ginger. I always carry bags of ginger chews because they're phenomenal, and I love the flavored ones.
Right. Ginger is great too. I mean, they use it for like nausea and pregnancy. Ginger has great data, to the lozenges especially. It helps.
Yeah. And well, I just love the taste in general, but I carry them whenever we travel. I have them on hand for the day after methotrexate.
Yeah.
I love them. And I know not all people love the taste of it, but I love it.
Yeah, you got to find what works for you. There's a lot of options out there.
Definitely. Okay, so my next question is collagen. Is collagen at all helpful?
If you look at the data for collagen is everywhere in our skin, in our hair, in our nails, it's a major protein, but it's such a large molecule that if you're eating collagen, I don't really know that all of it's being absorbed. You're essentially giving your body the ingredients to make collagen. So I don't know if taking collagen and then breaking it down in the stomach is going to add anything to it, because collagen is helpful for like if you have osteoarthritis a lot of time, because it's the building block of thing between the bones is the collagen. It's like the little pillows between the bones. And so in that case, I would say collagen may be helpful, but if you're taking it orally for rheumatoid arthritis, I don't know that it's going to offer much symptom relief. Hey, if you take it and it works for you, great. Congratulations to you. But there's no reason in my head that I would prescribe it to everybody.
Yeah, absolutely. I know that for me specifically, I take it because of my psoriasis. I feel like it does help my skin, but I wouldn't know if it actually helps with my joints at all. Yeah.
Right. And so that's a plus or minus in my head. Again, you always look at the risk benefit analysis. If somebody really wants to try it, I'm not going to stop them as long as I know it doesn't increase their bleeding risk, liver enzymes, things like that.
What would be your top recommendations for supplements?
I think the vitamin D, optimizing vitamin D is very important. The fish oil is important, again, for the long haul. Probiotics, if you can handle it. Those would be kind of my top 3 that I take those myself as well. And fish oil also helps because I have dry eyes with the arthritis. And recently I went to the ophthalmologist just last week, and he's supposed to be like a top dry eye person. I waited like 7 months to get into that appointment. Oh, wow. And the top 2 things he said were fish oil, GLA, which is gamma linoleic acid. Start with that and see how I do. And then supportive eye drops as well. I was like, I can't believe these words are coming out of his mouth, but I'll take it, to do these type of oils. And I had already started fish oil prior to seeing him. And I will say I noticed a little bit of an improvement in the dry eyes from taking those.
Did he give you a time frame for how long he thinks it'll take you?
Yeah, he said about 2 months.
Okay.
2 months to fully consistently be taking it. And you're looking at higher doses. You mean 1,000 milligrams of EPA plus DHA combined. Some people go even higher to 2 to 4 grams, but you want to be really careful going over, I would say around 3.5 to 4 grams, because there's newer data linking it to cardiac arrhythmias. So you don't want to be in that boat. We just need the right amount.
Absolutely. Okay, well, I'm going to check back with you in 2 months because I want to know how you're feeling.
Yeah, absolutely.
Okay, I have all kinds of notes based off of your website.
Oh, God.
I know. And some of them you've already covered, but I want to make sure I don't forget anything important.
Sure.
Okay. This is based off of one of your posts. What is the difference between joint pain versus joint stiffness?
Right. So that's an important one because we get a lot of consults for, oh, my child or I have joint pain. The first thing I will try to differentiate between is joint stiffness versus pain. And what I mean by that is when you are stiff in the joints, they feel stuck. Stiffness is just hardening, right? And they feel stuck. And you're going to feel that worse in the morning or if you're sitting in a long car ride. And the reason that happens specifically in arthritis, that's more indicative to me of something inflammatory like rheumatoid arthritis or psoriatic arthritis. It's because overnight when your joints move, they kind of crystallize. They sit there. I think of it like jello. So you feel stuck and you can't move very well in the morning. But then as the day goes along, you move a little bit, you wiggle and jiggle, you feel better. Versus somebody who's in pain, I need to know, is it a sharp pain? Is it a dull pain? Is it only in the morning? What makes it better? What makes it worse? If you're telling me your pain is worse at the end of the day, it kind of makes me think opposite of arthritis. It makes me think, is this more mechanical? Is there something going on in your how you're aligned? Do you have hypermobility? Because that's one of the more common things I see. And so we'll try to differentiate between arthralgia versus arthritis, which is the joint stiffness.
Oh, wow. Okay. That's a lot to unpack.
It is.
So do you ever see people that have both?
Yes, absolutely. And that's where kind of the water is a little bit muddy and you need to do your best as a historian to kind of help the doctor differentiate between the two. So it's, how are you feeling in the morning? What makes your pains worse? Because if you're having the stiffness plus you're still having pain during certain activities, I'm still going to work you up for arthritis, right? It's the stiffness that clues me into something inflammatory going on. If your pain, so then we do a pain diary and we really try to figure it out. We might be doing the blood workup in the background or imaging in the background, but in the meantime, I'm going to be asking you to keep a diary of your pain triggers, alleviators, aggravators. How often are you taking Tylenol or naproxen or, ibuprofen, things like that? But yes, most definitely you can see both. I will say for certain types of arthritis, like erosive arthritis can be very painful. Psoriatic arthritis can be very, very painful as well. So for me, the pain is gonna be there sometimes even no matter how much I've put the arthritis into remission. It's just the pain can be a lingering thing. So then we try to look for supportive ways to help with the pain.
Okay. All right. I think that's super important. So what would you do with somebody with hypermobility?
That's a good question. So hypermobility is a tough one, right? Because that means your joints are just double jointed, they're limber. Physical therapy to kind of recondition the brain to teach yourself like, whoop, I've gone past my endpoint. I need to go back. I need to bring it back because your body has lived in this position where it thinks it's okay to go past the range of motion and we need to bring it back. And so physical therapists or occupational therapists have kind of creative ways to do that, whether it's through splinting, bracing, taping, strengthening the core as well. So you're really engaging the core and not overextending your joints. It's important. It's a trial and error process, again, trying to learn what works for you and what doesn't.
Well, and I'm assuming that people like that probably have to be extremely careful with things like yoga.
Absolutely. Yes. So there's certain moves that you should be careful about, or when your body starts to ache in a certain way, it should probably clue you into, okay, what I just did, it wasn't right. Like it doesn't sit right with me. Just like food. It's like, I probably shouldn't do that again or eat that again. So it's the same. It's about learning what moves work for you and what doesn't and what's critical. Critical is core, always core.
I'm reading my last question and I think you already covered it. I can ask you anyway and you can tell me. How do complementary therapies help treat arthritis?
Yeah, so that's a important thing to note. It's not necessarily treat, but manage. So when I say it treats your arthritis, it's probably the symptoms of that you're helping treat. The arthritis or the inflammation itself is going to be different based on each person. Some people are blessed to be able to just control their arthritis with diet or certain supplements, right? But not everybody is like that. We're all on a spectrum. So the complementary stuff, if it didn't work to treat your arthritis or control your arthritis or manage your symptoms, then that's going to have to be accessory to the medications. So yes, the crux of your therapy is unfortunately going to be these medications that we all have to take, right, to manage it. And then the complementary stuff is going to be to control the stuff that the medicine's not going to help with. So that's going to be things like aches and pains that you get after yoga, or swimming to help kind of loosen up your joints a little bit, or what else is there? Yoga, acupuncture, mindfulness techniques, especially working through pain flares and whatnot. Or if you're about to go into a stressful period of your life, you better know that you probably need to journal every morning or every night. Just kind of knowing when to kick those into high gear and when you can just kind of coast on medications or maybe no medications.
Okay, I think you have answered everything so wonderfully.
Oh, thank you.
Is there anything that we have not covered that you think we need to talk about?
No, I think, like me going into this as a doctor, like the brain of a doctor and the body of a patient is kind of it's good and bad, because I know what I'm looking for when it comes to a doctor's visit. I know exactly what they're going to ask me. Great. Okay. I'm the best patient in that realm. But at the same time, I'm also not the best patient, because I think my expectations for myself are different, just knowing what the doctor is looking for. Right. So if I hear the word partial remission, I think automatically, oh, I'm such a failure. I've tried everything and it's still not working. Right. Like, I think it's important to give yourself grace, because it's not that you're not doing what you're supposed to be doing. It's not right for you. The combination is not the right one for you. So we're going to keep working until we move in that direction. And what are we going to do in the meantime to help you kind of cope? It's all about the coping in between. So it's tough. It's not a sprint. It's definitely a marathon, what we're dealing with here. I think also in the beginning, I had some wishful thinking that this was a one and done deal.
Don't we all?
No, totally not the case. It's not nobody's textbook. Just even if you are for now, you might not be later. That's just to tone down the expectations.
Absolutely. We need to just bring it back down a little notch, and that's okay, because there's so many amazing people. There's people like you and all these other in our community that can help support you and lift you up and help walk you through this.
Right. We're all in this together, and it's really, as awful as it is to have to go through it, right? My experience is I want you to share my experience. So whatever worked for me, yeah, I'll tell you, like, if it works for you, great. If it doesn't, we'll move on to the next thing. But if it worked, it worked. I hope it works for you. We'll keep our fingers crossed,
Oh yeah. Oh yeah. I have people come to me all the time and they're like, okay, so-and-so told me to talk to you. I found out you have psoriasis. I'm in so much pain. What are you doing? How is it working? How's it helping you? And I'm like, okay, I will tell you every product I try.
Right.
I will tell you the medication I'm on,
right.
but I can't guarantee it's going to work for you, because we're all different. And some people have come back and they're like, oh, wow, the lotions you use and all these different things, they're wonderful.
Yeah.
And some come back and they're like, I tried it. It worked for a while. It's back again with a vengeance.
Yeah. Yeah, that is the reality. And that is something you have to be okay with, or know going into this whole process, that this could be, it's a 50-50 shot here.
Mm-hmm.
But why not try it?
And we may try 10 things out there that we just wasted our money on and they didn't help us. We might try 3 and all 3 work perfectly.
Yeah. Yeah. And in that process, I think the most beautiful thing out of that whole process is the grit and perseverance and acceptance that you kind of start to build. And that is the most powerful thing that's going to carry you day in and day out moving forward, because you're like, it's okay. I know this. We're going to get right back up and keep moving forward. We're not going backwards. It's a book that we don't read backwards. We keep going forwards.
Absolutely. Okay. I'm going to ask you one last thing.
Mm-hmm.
What would be your best piece of advice for anyone out there struggling?
Depends on how you're struggling, right? Like, so if it's more of a physical pain, I would say, if your doctor is not giving you great input on how to help that pain, maybe reach out to people who have a similar diagnosis as you and see what's worked. Just like you said, how other people reach out to you. If it's the mental part, I think of just dealing with the chronic illness, I think it's important to realize that there's tons of help out there, first of all, at any price point, in network, out of network, whatever it may be. I recommend that you go see if talking to somebody would help, because sometimes releasing that through words or writing or art or whatever it may be is what you need, right? And grappling with the fact that there are things you can control about this, and there are things you cannot control about this. And so once you settle in with that feeling and really understand that, I think for a lot of my patients, that's worked wonderfully.
Well, thank you. You've been such a joy to have
welcome.
on here. Oh my goodness.
You.
I feel like I could geek out and ask you a million things.
I could always come back, not a problem.
Absolutely. I will make a list of everything we did not cover.
Sounds good.
All right. Well, thank you so much. And listeners, until next time, don't forget your spoon. The information, opinions, and recommendations presented in this podcast are for general information only. Consult your own physician for any medical issues that you may be having. The information should not be taken as a replacement for medical, clinical, professional advice, diagnoses, or medical intervention. My Spoonie sisters and guests will not be held liable for any of the consequences of such action or inaction. Trigger warning. Some episodes may cover sensitive topics including, but not limited to, suicide, abuse, mental illness, and chronic disease. You are advised to refrain from listening if you are likely to be offended or adversely impacted by any of these topics. None of the guests or hosts will be responsible for your use of the information contained therein. Life is not merely to be alive, but to be well. Living a life with a chronic illness is best described with one word: unpredictable. Be Well's products are designed to make the unpredictable easier to deal with. Back when I was getting my infusions, I would have loved to have their adult zip hoodie. They even have one in pink. They also have everything from one-day pill holders to urgency buckets. So remember, they want to make your life a little easier. So be sure to check out Be Well.